What are we learning in this video?
Today we are learning some sentences.
Kannada.
Yes, Kannada sentences.
Between doctor and patient.
And patient.
Yes. So when the patient goes to doctor, what will they say?
Sit. Kutkoli.
Kutkoli. Sit.
Kutkoli.
Then the doctor will ask,
Hello, what is your name?
How do you ask that in Kannada?
Namaskara, nimma hesarenu.
Namaskara, nimma hesaru yenu. Very good. Then the doctor wants to ask the age. What is your age? How to ask?
What is your age?
In Kannada?
Nimma vayassu
Yeshtu. Nimma vayassu yeshtu. Wait, let's change this. It should be yeshtu. Can you say that again? Vayassu?
Nimma vayassu yeshtu.
Very good. In case you want to ask the patient their occupation, you have to ask Kelasa. What is occupation?
Occupation is Kelasa.
Kelasa. So if you want to ask the patient occupation, you'll have to ask Kelasa. Okay,
Kelasa.
Shall we move on?
Yes.
So now you got the person's basic details. So let's move forward. You're going to ask the complaints, chief complaints. How will you ask? Yenu?
Yenu tondare.
Yenu tondare. What is your problem?
Yes.
What are your
complaints?
Okay. And then the patient will say, let's say the patient says fever. How will the patient say? Jwara. Okay. Then you have to ask the patient, from when do you have fever?
From when do you have fever?
Jwara yavaginda. Yeah. So from when do you have fever? Jwara yavaginda. Are you understanding?
Yes.
Shall we go to the next slide?
Okay.
So now you got to know that the patient has fever, correct?
Yes.
So now you want to do physical examination of the patient, okay? So how will you ask the patient to look up?
Nodi melege.
Mele nodi.
Mele nodi.
You want the patient to look down.
Kelagade
nodi. So you will look. Patient will look up for you to check the pallor. When they look down, you can check the icterus. Okay, so that's why mele nodi, kelagade nodi. Okay, mele nodi, kelage nodi. Then, if there is pain for the patient, you should ask, where does it pain? Yelli novutte. How will you ask the patient? Where is the pain?
Yelli novutte.
Then the patient says something. Then you want to press that place and says, does it pain here? You want to ask, does it pain here? Illi novatta. So you ask the patient, yelli novatte. And then you point to one place and you ask, illi novatta. Very good. Next. Then you will tell the patient, we have to operate. We need to operate. We need to do one operation. How will you tell the patient?
Operation madbeku.
Very good. Operation madbeku. Then the first thing the patient will ask is, how much will it cost? Eshtu duddu agatte. How much money? What will the patient ask? Eshtu duddu agutte. That means you should understand. Duddu means he's asking about money. How much money will it cost? Or the patient can ask, eshtu kharcha agatte. That means how much will it cost? Kharcha kitna hota hai? Hai na? Duddu money. Duddu money. Very good. After the operation, you are going to the patient. What will you ask the patient? How are you now?
How will you ask in Kannada? Iga hege iddira.
Very good. Then you want to ask the patient, did you take your tablets? Matre
togondidira.
Matre togondra. Did you take your tablets? So in this video you learnt so many Kannada phrases, sentences between doctor and patient. Yes. Correct?
Also a little bit of words.
Words also you learnt, yes. So you have learnt so many phrases in this video. Hope you have liked and enjoyed this video. Say bye.
Bye.